Hello and welcome to Askimo TV. We're talking today to Dr. Nisith Sheth. Dr. Sheth is a consultant dermatologist and dermatological surgeon at St. John's Institute of Dermatology in London. Hi, Dr. Sheth. How are you?
Very well, thank you. How are you?
Very well, thanks. Dr. Sheth, today's topic is going to be psoriasis. What is psoriasis?
So psoriasis is an immune condition of the skin which causes an inflammation of the skin and sometimes the joints as well. When a person has psoriasis, the skin replacement process speeds up and takes a few days to replace the skin cells that usually take, for example, up to 28 days. The skin cells build up and form, in many cases, plaques on the skin, which can be flaky and scaly and red. And in darker skin types, you can get darker patches. There are a number of different types of psoriasis, but the most common kind, you get these type of well-defined plaques on the skin.
What causes psoriasis and who is at risk?
Psoriasis, the causes of psoriasis aren't completely understood at the moment. We know there's certainly some genetic factors, but the pattern of inheritance isn't fully understood. It's a common condition affecting, in the UK, for example, up to 2 to 3% of the population, so up to nearly 2 million people. It commonly occurs at two peaks. Late teens to early 30s, between the ages of 50 and 60. Some people who also have psoriasis,
Sorry, carry on.
Some people with psoriasis can also get joints and joint problems, and some people with joint problems with psoriasis don't have any skin condition at all.
What are some of the signs and symptoms of psoriasis that may indicate that somebody should seek the help of a medical professional?
So for example, some of the symptoms that may occur are redness and soreness, considerable flaking. If it's causing a lot of disfigurement and particularly psychological upset, these can often lead to further treatment.
How would you diagnose psoriasis?
So the vast majority of cases, psoriasis is diagnosed by a clinician, particularly a dermatologist, by looking at the skin and taking a good history. In most cases, psoriasis doesn't require any further investigations. We can often see from the pattern, from the clinical appearance of the skin lesions, which are well defined, red or pink and have a silvery scale, and from where these are. So they're often, in the first instance, on the elbows and knees, anywhere where the skin becomes traumatized readily. And often in many different parts of the body. Sometimes it can be difficult to distinguish it from other conditions such as fungal infections, and in those cases further tests such as a scraping of the skin or a skin biopsy may be required.
What do you feel are some of the most successful treatment options available for psoriasis?
There are a number of different treatment options available, and in the past 5 to 10 years, the options have increased considerably, particularly for the more severe types of psoriasis. The mainstay of treatment for many patients with psoriasis is in the form of creams, and these include simple emollients, but also vitamin D derivative creams and steroid creams, coal tar creams. Can all be very effective if used appropriately and with proper guidance. For more severe types of psoriasis, ultraviolet light under medical supervision can help in a number of patients. but care must be taken with side effects, particularly long-term side effects of development of skin cancers. Or the more severe types of psoriasis.
Sorry, carry on.
For the more severe types of psoriasis, there are a range of treatments, oral treatments, and most recently agents called biologic agents, which are much more targeted and can produce a very good quality of life in appropriate patients.
Can you cure the psoriasis, or is it just about making the psoriasis more manageable?
Psoriasis at the moment can't be cured, but many patients with psoriasis with appropriate treatment can have a very normal life without the condition affecting them too much if it's appropriately controlled.
Thank you, Dr. Sheth. Thank you so much for talking to me today.